Topic: Parasitic burden and severity of malaria in Tanzanian children. Definition: malaria or malaria is a life-threatening disease caused by parasite that is transmitted to humans by the bite of infected female Anopheles mosquitoes. It is a preventable and incurable disease. Children under 5 years of age are the most vulnerable group affected. In 2019, they account for 67% of all malaria deaths worldwide. Application: children were classified as having severe malaria in accordance with World Health Organization criteria level 5 per deciliter, prostration more than one convulsion in the past 24 hours, respiratory distress or hypoglycemia. Children were classified as having moderately severe malaria if they did not fulfill the criteria but had a last one of the following symptoms: a hemoglobin level lower than 6 per deciliter, hyperthermia, one convulsion in the past 24 hours, or a respiratory rate greater than 40 breaths per minute. Most cases of severe and moderately severe malaria were treated with quinine. Pros: even if it no a benefit, however, looking most malaria cases are slight. Severe malaria is unlikely to occur after 5 years of age. Cons: malaria is a parasitic disease that may have serious consequences. Note even the use of mosquito about infection. You can produce serious problems in the fetus in the pregnant woman. The symptoms are respiratory distress, seizure, or severe anemia. Should apply in Ecuador. In the case of Ecuador, unfavorable results are shown that to increase this disease. These results also show that the political and social intention to eradicate this disease from the entire Equatorial region has been considerably weakened, which constitutes a risk for the entire population due to current changes in government policy in the region, country against the will of the most vulnerable community. Conclude. Resistance to severe malaria was not acquired after 1 or 2 meal infection. Although the parasite burden was higher on average during episodes of severe malaria, a high parasite burden was often insufficient to cause severe malaria even in children who later were susceptible. The diverging rate of severe disease and high-density infection after infants, as well as the similar parasitic burden before and after severe malaria, indicate that naturally acquired resistance to severe malaria is now explained by improvised control of parasitic density.